Mr. Whitten. My name is Simone. I'll be your nurse today. Can you please provide me your name and date of birth?
Detrick Whitten, March 2nd, 1989.
And can you go ahead and tell me where you are?
At a doctor's office.
Thank you. Can we go ahead and start? Is it okay if I go ahead and touch you and ask you personal questions?
Yes.
Okay, and you know what you're here for today?
Head to toe assessment.
Alrighty. So first we're going to start by going ahead and checking your head. Just making sure there's no lumps or bumps. Everything's even. Can you go ahead and smile for me? Frown. Close your eyes. Puff out your cheeks. We'll be testing your cranial number 7 for the facial cranial. While your eyes are closed, will you go ahead and tell me whether this is sharp or dull?
Sharp. Dull. Dull. Sharp.
And with your eyes remaining closed for me, that was testing cranial nerve number 5. With your eyes remaining dull, can you go ahead and tell me what you smell?
Coffee.
Okay, thank you. That's testing cranial nerve number 1 for your olfactory. You can go ahead and open your eyes for me. We'll go ahead and check your eyes out. Will you go ahead and shrug your eyebrows for me? Testing cranial nerve number 3. Okay, direct convergence. And now we're going to check indirect. Okay, thank you. Go ahead and look at your conjunctiva and your sclera. Just checking your lacrimal processes. All right, we're going to go ahead and do accommodation. I want you to go ahead and stare at a point on the wall. And now go ahead and stare at my pen light. Okay, your pupils constricted nicely. So now we're going to go ahead and I want you to follow my pen light. This is assessing the cranial nerves number 3, 4, and 6. Next, I want you to go ahead and look up for me. We're going to go take a look in your nose. So head up, please. Okay, and will you go ahead and cover one nostril for me? Breathe out. And will you cover the other? Thank you. I'm going to go ahead and check your sinuses. Have you had any sinus pressure or anything lately?
No.
Okay. Thank you. I'm going to go ahead and check your ears. Will you turn this way? Okay, so I do see a little bit of wax, but nothing serious. Thank you. What we're going to go ahead and do is perform a hearing test. This will be the Rhine test. Can you go ahead and tell me that you hear it on both sides?
Yes.
Okay. This will be the Weber test. I want you to go ahead and tell me when you no longer hear it.
Can you hear it?
And tell me when you no longer hear it.
Can't hear it.
Thank you. That was testing the cranial nerve number 8. We're going to go ahead and do the whisper test. Will you go ahead and cover one ear for me?
Spider-Man.
And will you go ahead and cover the other ear?
Superman.
Thank you. Next, we're going to go ahead and take a look at the mouth. Will you go ahead and open your mouth for me? Okay, so I do see one tooth is missing. Will you stick your tongue out for me?
Ah.
Stick your tongue out and say, ah.
Ah.
Uvula and and tonsils. Okay, will you go ahead, lift your head up, lift your mouth up, open it for me. Hard palate and soft palate. Will you lift the tongue up towards the roof of your mouth? Thank you. One more thing, will you go ahead and stick your tongue out and press against the tongue depressor? Thank you. That was going to go ahead and test your cranial nerves number 12, 10, and 9. Just open your mouth wide for me. I want to go ahead and check your mucous membranes. Everything is nice, moist, and pink. We want to go ahead and check. Go ahead and close your eyes for me. And clench your jaw. Go ahead and palpate. Thank you. Now will you go ahead and turn slightly to the side? Thank you. Next, we'll be going ahead and checking your palpating for your thyroid. So I want you to go ahead and lean your head to the right. Thank you. Your thyroid is not palpable. Can you go ahead and face forward for me? You're going to go ahead and check your carotid. Okay, it's a +2. +2. And will you go ahead and swallow for me? Thank you. Next, we'll go ahead and listen. With the diaphragm of the stethoscope. No bruits. No bruits. And next we'll go ahead and listen to your thyroid, as well as your trachea, for no bruits. Go ahead and lift your hands out for me. Okay, so your skin is cool, warm. I do see your blood vessels. They stick out close to the skin. Is that normal?
Yes.
Okay. Nails are clean. Capillary refill 2 seconds. Apical ++2 bilaterally. Will you go ahead and push against my hand? Push up against my hand. Thank you. Go ahead and squeeze my fingers. Okay, great grip strength. We're going to go ahead and check skin turgor. Okay, and go ahead and push against my shoulders. We're checking cranial nerve number 11. Just shrug for me. Thank you. Will you go ahead and slightly this way? We're going to go ahead and auscultate your back for your lungs. Just go ahead and checking, making sure there's nothing on the back. Will you go ahead and breathe in for me? And breathe out. Thank you. Every time you feel my stethoscope, go ahead and take a deep breath in for me. Thank you. I'm going to go ahead and percuss. you. Go ahead and face me. Next, we're going to go ahead and check for phlebitis. Go ahead and deep breath in for me. And deep breath out. Thank you. Go ahead and say 99.
99. 99. 99. 99.
Thank you. Next, we'll go ahead and listen to your lung sounds on your chest. Every time my stethoscope moves, will you take a deep breath for me? Next, we're going to go ahead and take a listen to your heart sounds with both the bell and the diaphragm. Intercostal space number 2. Listening to the aortic. Listening to the pulmonic. Listening to Erb's point. Listening to the tricuspid. Now listening to the mitral, which would also be the apical pulse. And you also take this down for 1 full minute. Next, we're going to go ahead and check your reflexes. So we'll do the radial. Just relax. Don't think about anything. Next. Next, the brachial. And then your brachial. Will you uncross your legs for me? Thank you. Next, we're going to go ahead and do your knees. And your Achilles. And will you go ahead and lie down for me? Will you go ahead and turn your head to the left? You want to go ahead and check, make sure there is no jugular vein distension. There is no jugular vein distension noted. Next, we are inspecting the abdomen as well as the chest. Everything symmetrical, no colors. No bulging. I'm going to go ahead and listen to your stomach. Starting in the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Next, we're going to go ahead and listen to your renal arteries. As well as the iliac arteries. Next, I'm going to go ahead and listen to your liver. And your spleen. As well as your aorta. Next, I'm going to go ahead and palpate. Actually, first I'm going to go ahead and percuss in all 4 quadrants. And next I'm going to go ahead and palpate. Just light palpation. Tell me if you feel any tenderness. There's no tenderness, no pain or anything?
Nope.
When was the last time you had your last bowel movement?
Yesterday.
And what did it look like? Was it normal?
Normal.
Describe your normal for me.
Solid brown.
Was there any foul smelling odors?
No.
And your last void? When the last time you used the restroom?
This morning.
And what was it like?
Yellow.
Any
Black.
foul smelling odors?
No.
Any burning with urination?
No.
Next, we'll go ahead and check the legs. Okay, legs are warm, dry, skin's intact. I do see some bruising. Old, well, not really bruising, but old scars. From childhood or work?
Childhood.
We'll go ahead and check your pedal pulses. We're going to do the dorsalis pedis. And then the posterior tibia. Posterior tibia. Okay, both are +2. We're going to do capillary refill on your feet. Okay, and if you'll go ahead and roll over onto your side. Gonna go ahead and check sacral edema. Okay, no sacral edema. Last thing I need you to do is actually need to check your gait. So I need you to get up and walk heel to toe. And you can turn around and go back. Nice and steady. And while you're standing there, you can actually stand this way. I want you to go ahead and stand feet straight together. No, feet together. Arms straight up. This is checking your balance, and it is negative. Thank you. You may put your arms back down and have a seat. Did you have any questions or concerns for me today?
No.
Thank you. Well, that concludes your head to toe assessment.